That's good.
All right. First question is always the toughest. Could you say your name and spell it for us, and then give us your title?
Sure. Yeah, it's Alex Wright, Alexwright, medical physician over at Mercy Health and director of primary care at Mercy Health Paducah.
All right, Dr. Wright, could you just go on and I guess just kind of give us an overview as of like right now, COVID situation is in Western Kentucky and kind of what you're seeing in your role right now?
Yeah, absolutely. So still we're seeing quite a bit of COVID illness and COVID related illness. There have been some improvements as far as the number of inpatient stays related to COVID at this time. I do hospice care as well, which I forgot to mention, but for hospice care, we did have quite a few increased visits for patients with COVID. So we do help provide care for those that are having major discomfort from it. Sadly enough, though, with hospice care too, we do see many patients die related to COVID and COVID-related deaths. About 1 month ago, we were definitely maxed out as far as our facility. We were seeing deaths on a daily occurrence overall. Now we still do have COVID-related deaths on a weekly basis and still several of them. So the reality is it's still very severe as far as the numbers that we're seeing. We're definitely not out of the woods at this point in time. We are seeing some improvement, in which case part of that is definitely the rollout of the vaccine being better accepted and also people getting some natural immunity. But we are still concerned that we may see further waves in the future as either immunity wears off, for those who have had COVID naturally or for those who have had the vaccine and may have not received a booster. So we still do have concerns. We can see future waves that can be very, very bad.
Okay. You mentioned about a month ago being maxed. Is that partially from Delta variant? And is that kind of still what you're primarily seeing at this point here in mid-October?
Right. Yeah, we're still seeing the fallout from the Delta variant. So it's still spreading. Of course, with schools being open, there is the spread of COVID. Thankfully, children oftentimes don't get as ill, but the concern is obviously being a parent myself, I realize that I'm not going to be distancing from my children. So it's easier to pick it up often from them than it is from a coworker. So we're still seeing that fallout from essentially the Delta spread through the Midwest that started this summer. So most cases are assumed to be of the Delta variant in general at this point in time.
Okay. You mentioned children, so that's a great transition to my next question. Right now they're not able to be vaccinated, but there's discussions of moving that in with Pfizer and others. So I guess kind of what's your take right now on vaccines for kids in that younger age range and what it might mean if parents do decide to start getting their kids vaccinated when it is available?
Right. So definitely the concern is COVID in general is so infectious. It reminds me of chicken pox prior to the vaccine. It was not a matter of if you would get chicken pox, it was a matter of when you would get chicken pox as a child. So the concern for COVID is for both children, for infants, for adults, for the elderly, all ages. It really is a matter of if you are unvaccinated, when will you get COVID? Of course, there may be some exceptions, but we think it's going to be a small percent of the population that would never get COVID if things proceed naturally. Of course, my goal anytime I do treatment is to either help people live better, live longer, or actually to reduce their healthcare costs too. If something doesn't meet that, then generally it's a waste of time, money, and putting someone at risk. So the good thing is with clinical trials, this is what we use to help decide if a new heart failure medicine is something that we should try with a patient, if an antidepressant or any vaccines that previously we've used in the last several decades. If clinical trials do show those benefits, then of course at that point in time, I do weigh as a practitioner, is that something that I would want to use for myself or for my own family members? So we do know without a doubt that it is spreading for younger folks with the Delta variant. The amount of disease burden for younger folks is higher than it was originally with COVID as well. And that is a major concern is as COVID continues to persist, is anything in nature takes the path of least resistance. And so the least vaccinated population is generally children at this point in time. So with that concern in mind, the concern is too that future variations and mutations of the Delta variant or COVID in general could be more aggressive for children. Good thing is clinical trials in general have shown that actually the teenage group, so originally what has now been accepted, and I do vaccinate teenagers 12 and older with Pfizer, is that they tolerate it and tolerate it generally better than most adults. The current clinical trials as well for the younger age groups, which are down to 5 at this point in time, use a reduced dose, which is very similar for whether that's the flu vaccine. We usually use a reduced dose for that. And in that case, the participants have tolerated it well, showing good immunity as well. A thing that's reassuring is we always need to look at the history in anything in life. And for vaccines, the big part of history is looking to see is a vaccine a live vaccine or something that's not a live vaccine. None of these are live, which is good. So historically, we typically see serious reactions occur within the starting or 6-week time period that your body transitions from new immunity to a long-term immunity. And so history tells us that generally for a non-live vaccine, after 6 weeks, side effects aren't expected as the body clears it. And we're not seeing that in the trials too. So what that tells me as a practitioner in summary is, without a doubt, we do have, definitely a lurking disease in the community. It could be something that may impact my child or it may impact one of their classmates. But of course, this is similar to polio in the past. It wasn't just something that needed to be given to children to prevent children from getting sick. Adults needed to do their part to help prevent children from getting sick. So in this instance, we still know that the elderly and at risk, the more we vaccinate around them, the less likely they are to get ill. And children are a big part of that population. But also going forward, the concern is, how much disease burden that we may see in children, we don't know. And obviously, we don't want to see it increase, which is a real likely potential.
Okay, thank you, sir. I guess from what you've seen so far, and you said you are vaccinating teens right now, 12 and older with Pfizer. So, if the data comes back good, and in your mind, is this a good idea for people that are, with kids that are 5, 6, 7 years old, if that's what the data shows from the research right now?
Yep, it is. So without a doubt, I can understand being a parent and just being a provider as well and taking care of children. Anything that's new is always of concern. However, what we are finding across the board, whether that's in adults, whether that's in a 12-year-old that can receive the vaccine, or whether that's a 7-year-old that's in the test group right now for vaccines and doing well with the vaccine, is that generally what our fears are from the vaccine is far less likely to occur than if we let the person have COVID. So usually if we do the math, if for instance, even though there have been, of course, reactions to vaccines, and they are very rare, typically they're far more rare than having a bad reaction to ibuprofen or to having an antibiotic. We know that the math breaks down to you're far more likely to 1, catch COVID, and 2, have a bad case of COVID that causes that ailment or disease, but to a greater extent typically. So I do think that it is something that's going to be important and needed for children. Pediatricians in general have reviewed throughout the country data, and the large general consensus is that overall the vaccine is rather safe, and the benefits far outweigh the risk. Of course, it's not perfect, but COVID certainly is the farthest thing from perfect, and I'd rather keep my children personally safe from something that's far more likely to injure them.
Dr. Wright, you mentioned boosters earlier. I know that Moderna and J&J are looking at different kinds of options for boosters. At this point, I guess there's been some mixed ideas on the research. So what's your take on boosters right now? Would you recommend them for certain patients or all your patients, or where are you with boosters at this point?
Right. So certainly right now, I do recommend boosters. This is very similar to, once again, perhaps polio in the past. A good example is children still receive boosters against polio. Polio exists in other areas of the world. If we let our guard down, we'll start to see it come back in the US. So once again, even though the vaccine is not perfect, it is still extremely effective. It's very clear that those that are boosted with the vaccine have improved immunity. They spread it less as well. No, it's not perfect at absolutely preventing it, but it's almost perfect at preventing death, meaning about 98, 90%, 99% effective. So in general, the more that we do have patients boosted, that allows for everybody to keep a certain level of immunity up, and that decreases transmission to those that either can't have the vaccine or have not come around to it yet, or even to pediatric patients that will be less than this age 5 that's being proposed for potential release here soon. So certainly at this time, I am giving boosters in my own office, and recommending to patients that have had Moderna or the Johnson & Johnson to simply keep an eye out, to call back, check with their providers about when those boosters are available. I'm seeing that they're well tolerated, and generally what we have seen, and this is predictable based on just science and history, is that boosters tend to be better tolerated than the initial vaccines, as the body is somewhat used to it, and it just helps boost that antibody level. We usually just see less inflammation whenever somebody is re-exposed to something, which is why people tend not to get as sick if they've had an illness twice or if they've had an immunization before too.
Okay. I think we've seen some stories that the level of people getting boosters is maybe higher than those who haven't been vaccinated and are getting their first and second doses. I guess the folks that may still be around or watching this evening, what's your recommendation for if they are hesitant? Who should they talk to? What would you say to them if they're still not sure about going ahead and getting that vaccine?
Yeah, absolutely. So the vaccine reminds me a lot of other things that we do in life that we don't want to do, whether that's a mammogram, a colonoscopy, exercise, etc. Afterwards, almost everybody comes back and says, I'm definitely glad I did this. I don't have to worry about the risk of death, the risk of going bankrupt if I go in the hospital, because now I've taken activity or proactivity there to decrease that risk. So I think that makes sense why we do see people being very apt to want the booster as soon as it's available, is if they've had it, they see, one, they tolerated it, two, their risk of some of the ill outcomes that we are still seeing in our community, whether that's something that's public or friend or family member that has occurred. We know that if we've been immunized, generally our risk is decreased substantially. So I do talk to a lot of patients about it and mention that generally after people do have the vaccine, it's similar whenever people past 50 have their first colonoscopy. By God, nobody wants to sign up for it because, one, it's not enjoyable. Two, yes, there's some risk. But the main thing is patients come out of that knowing at least I don't have that amount of risk hanging over my head or of the unknown in the future. So I would tell patients just in general, if you do feel uneasy, talk to a healthcare professional. I'd recommend talk to your family physician, your nurse practitioner, your physician assistant. You do want to talk with somebody that's used to reading research studies. And that is the issue of today's world, is you can literally find an opinion that you want to find, even if it's incorrect. And with the multitude of research studies too, there are varying degrees of what we call power of research studies, meaning the accuracy and reproducibility. And it does take somebody with a trained eye to be able to sometimes sort through all of that. So I would definitely recommend reach out to your healthcare professional. Health departments generally have excellent staff that stays up to date on preventative medicine quite well, and they are usually led by a medical professional as well. And those would be probably your best place to get a true down to earth opinion on what the numbers mean for you, and what benefits and risk you might have with the vaccine.
Excellent. Okay, Dr. Wright, those are my only questions. Anything I forgot to ask or you'd like to add to us tonight?
No, I think that hits the nail on the head. I definitely think it's important for people to realize that this is definitely such an infectious virus that we know at this point in time, social distancing is not going to prevent spread forever. If you interact with the world, that is your chance in basically getting it. So I have literally seen patients get it to where they have one contact that does their grocery shopping, they get their mail, etc. But they do have to have contact with the world in one way or another. And unfortunately, this virus is so infectious and we have no pre-existing immunity to it. We're all just sitting ducks for it, essentially. So it's a sad reality, but it's reality we have to face.
All right, sir. I'm going to stop the recording.